The following animation demonstrates best practice in the setup of the TrueWave disposable pressure transducer. Prepare the TrueWave transducer using the following 6 steps. Step 1. Using aseptic technique, remove the transducer kit from the sterile packaging and ensure all connections are secure. Step 2. Insert the TrueWave transducer into a mounting backplate that is secured on an IV pole. Step 3. De-air the IV bag and prime the TrueWave system. Invert the normal saline IV bag so air raises to the base of the bag. Anticoagulation per institutional policy. Spike the IV bag with a fluid administration set, keeping the drip chamber upright. Open the roller clamp on the IV set. Open the vent port by turning the stopcock toward the patient's pressure tubing and away from the transducer while leaving the vented cap in place. While keeping the IV bag inverted, gently squeeze air out of the bag with one hand while pulling the snap tab flush device with the other hand until air is emptied from the IV bag and the drip chamber is filled at least halfway, per institutional policy. Step 4. Gravity prime the TrueWave system. Insert the IV bag into a pressure infuser bag and hang on an IV pole. Do not inflate. Pull the snap tab flush device to deliver the flush solution through the TrueWave transducer and out through the vent port's vented cap. Remove all air bubbles. Close the vent port by turning the stopcock towards the cap. Holding the pressure tubing in an upright 45-degree angle, pull the snap tab to flush the remaining part of the line through the end of the tubing. Step 5. Fast flush the TrueWave transducer system. Pressurize the IV flush solution bag to 300 milliliters of mercury. Pull the snap tab to flush the system under pressure while tapping on the tubing and stopcocks to remove any residual bubbles. After removal of any residual bubbles, connect the TrueWave transducer to the bedside physiologic monitor for calibration. Step 6. Replace all the opaque vented caps on the side ports of the system stopcocks with non-vented caps. Now that we have completed priming the system, we will need to calibrate the TrueWave transducer with the bedside physiologic monitor.